Good morning. Thank you for joining us here today. I have Dr. Brent Roussin with me today, and thanks again, Brent, for all your work and the work of your team, too.
Thank you for that.
On Friday, I was very pleased to join with our Health Minister, Heather Stephenson, and our Justice Minister, Cameron Friesen, in his hometown of Morden, and we had a chance to tour Manitoba's newest vaccine super site, which officially opened its doors to the community yesterday afternoon. And I just wanted to commend our Vaccine Implementation Task Force for their continued efforts to build a flexible vaccine rollout plan that's multidimensional, but it's focused on providing life-saving vaccines to as many Manitobans as quickly and safely as possible. I wanted to also say a special thank you to our hosts for touring us around and introducing us to a lot of the processes they're going to use there. This site will be the fourth so-called super site to have been established throughout the province. We started with Winnipeg and then Brandon and Thompson and now Morden. And interestingly, in Morden, they're piloting a new model that aims to speed up the immunization process, provide better patient care. Essentially, you stay in your chair and they come to you, as opposed to the other way around. And it'll be interesting to see as we go forward how that the results of that pilot work, and see if this is a way we can further improve our vaccination services to you. And again, our vaccination team's always looking for ways in this unprecedented time, with this unprecedented challenge, to better improve our processes and better protect Manitobans. Right now, of course, as it has been for some weeks and months now, our limiting factor is the amount of vaccine that we have. We're still, as a country, ranking about 50th, I think, in the world on getting vaccines out, and that is the limiting factor, whether it's in Brandon or Winnipeg or anywhere else. We have the capacity to deliver much more in the way of vaccinations. We have the folks ready to help if we need them, and our wait now, hopefully not too much longer, is just for vaccines to arrive here in the province. This is the same, not just in Manitoba, of course, but right across the country. Other premiers have told me that they too they've ramped up, as we are here. I want to also say congratulations to our vaccine team. I understand there was an independent analysis done of the vaccine strategies or the vaccine implementation squads throughout the country, and Manitoba's team got an A. I think along with Yukon, the highest ranked teams in the country. So congratulations to our folks for their diligent efforts. If you wanted more information on vaccine super sites or on pop-up clinics, locations, who is eligible to book an appointment, how to book an appointment, anything like that, visit www.protectmb.ca. Now, while there's much reason for hope with vaccine advancements, I keep reminding people, I know you probably don't want to hear me say it again, but I'll say it again, the cavalry's not here yet. We're not out of the woods yet. And other analogies like that explain that we cannot let our guard down. We have to keep playing defense. Only 9% of our population has been vaccinated, which means that 91% have not. And so the methods we've been using to bend the curve down, we have to keep using to keep that curve down. As more Manitobans get back to doing some of the activities that they love and that they've missed over the past number of months, the risk of increased case numbers is real as our interactions rise. And the risk of community transmission is also real. The risk of variants adding to that concern are very real as well. And so this is why we will continue to proceed with caution. That's why today we are announcing that, based in part on your feedback, your continued concerns and ours at this table over the risk of rising variant case numbers, plus ensuring that our health system remains fully ready to deal with COVID-19, but also that it can get ready to deal with other medical needs. For many Manitobans, they've been waiting for surgery or treatment of some kind. We'd like to get back to providing those services in a more expeditious manner than COVID has allowed us to do. So as a result of these concerns and others, we're making only minor changes today to the current public health orders. All of Manitoba will remain at the critical or red level on the pandemic response system for the time being. Well, these changes are that we are going to announce, Brent will announce shortly, are cautious changes, and they are designed to help us move in the direction of protecting and safeguarding the well-being of Manitobans in all respects, including in terms of your mental health and your social desires and needs, are not without consideration as well. Ces changements sont encore une fois des changements prudents pour nous assurer de continuer à protéger des vies du Manitoba. I'll now pass it over to Dr. Roussin to provide more details. Brent, over to you.
Thank you, Mr. Premier. Good morning. So Manitoba is going to continue to move forward with slow, cautious reopenings. These plans will leave us remaining at the critical or red level on the pandemic response system. On Friday, the following changes will be put in place for all health regions in Manitoba. Outdoor gathering limits in public places will increase to 25 people. Limits for weddings, funerals will increase to 25 people. Retail stores will expand to 50% capacity or a 500-person max capacity, whichever is lower, with, of course, the other public health measures still remaining in place. Drive-in religious services will be allowed to, people will be allowed to leave their vehicles while still observing the other public health measures. All other previous health measures will remain in effect. These changes will come into effect on Friday, March 26th, and will expire on April 15th. We still need to be cautious with our approach. We see recent slow increases in case numbers. We're seeing increasing proportion of our cases related to variants of concern. We continue to monitor very closely the hospitalization data, as well as those case numbers related to variants of concern. So we haven't made changes to indoor or outdoor gathering at personal residences because we know these prolonged contact had been a significant factor in our beginnings of our second wave. And we'll again be able to look at further reopening steps after spring break and Passover and Easter as our data supports. We all need to continue to work together to keep these numbers down. We know what happened following Thanksgiving gatherings early in our second wave, and we need to know we have to continue to avoid that from happening again. The variants of concern just add to that level of risk right now. So we know these variants spread much more readily, and so we need to continue to do what we can to limit that transmission. So there continues to be reasons to be optimistic, but we need to be cautious in the meantime. We don't have nearly the amount of vaccination coverage that we need to change our public health measures, but we can be optimistic that more and more vaccine is on its way over time. We just need to be cautious again for the near future. We need to continue to follow the fundamentals. We need to avoid those activities that we know transmission occurs in, and those are the crowded places, closed-in spaces, close contact settings. We need to continue to protect our most vulnerable Manitobans until more and more people are eligible for the vaccine. So we're definitely getting closer. There's definite reasons to be optimistic for our future. It's just right now it's still we're still required to remain cautious for the foreseeable future. So thank you again, and I'm going to turn this back over to the Premier.
Thanks very much, Brent, and I think Dr. Roussin looked great getting that needle in his arm the other day. I just wanted to congratulate him. I know a lot of us younger people are pretty excited about getting ours pretty soon as well, Brent, and good for you for setting a fine example for everybody else to follow here. We need to have more people in Manitoba get that vaccine as soon as they can, and the more people to get that vaccine, the sooner we can get these restrictions lowered. Our number one priority in the face of this pandemic has been and continues to be protecting our most vulnerable people and ensuring that our healthcare system's there for all Manitobans when they need it. Not just now, but well into the future as well, well after this pandemic is gone. We're also focused on creating an environment for economic growth and a sustained reopening of our economy so our businesses can safely reopen and stay open. That's why we've developed very, very strong supports for our small business community. I'll have more to say on this later this week. At every step of the way throughout this pandemic, we have endeavored as a government to reach out directly to Manitobans to get their input, feedback, and priorities on a variety of measures designed to protect Manitobans from this deadly virus. And I was listening to some comments on a interview the other day with Dr. Atwal. One of the reporters said they were going to be the devil's advocate and say that we already knew exactly what we're going to do today or the following week in this instance, and that we really weren't interested in listening to Manitobans. Nothing could be further from the truth. We absolutely will continue to engage with Manitobans as we did this past week, and I want to say thanks to Manitobans for their input. Over the weekend, we had nearly 32,000 responses provided. That was just since March 18th. And when we asked Manitobans for their input, we listened to it. And we asked you for your input on whether we should move from red to orange, and the comfort level wasn't high on that. And the announcement we made today is at least in part because of the input we got from Manitobans. Because you see, public health orders only work if we work at them. And when we involve Manitobans in getting input, we do it sincerely. We do it for a reason. And that is to make sure that the plan we have for Manitoba is designed for and by Manitobans. That's the plan that we put into place, and you're making it work. And so, you know, yeah, we had a rotten time after Thanksgiving. There's no doubt about it. And we lost good people. People will never get back. And it was sad. But we also rose to the challenge of saving thousands of lives after that by doing the right thing and bending the curve. And we did it together as people. And I think that's a cause for celebration for Manitobans. So yes, we're going to keep asking and we're going to keep listening too. Now I understand I'm not going to make everybody happy. Surest way to fail. You know, some of you said we're going too fast. Some of you said we're going too slow. You know, we're not always on the same mind. My dad used to say if two fellas are always thinking the same way, one of them isn't doing much thinking. So we're going to have different views on this. But at the end of the day, what we come up with as the plan is our plan. And so I encourage Manitobans to stick with the plans that we've outlined, follow the health orders, because that's how we make it work. Since we began our cautious and gradual approach to reopening our economy nearly 2 months ago, because of the actions Manitoba took in bending the COVID curve, I've said, and I'll keep saying, the future's in all of our hands. And when I say we're different people than we were last fall, I mean it. I think people understand across this province how important they are now to one another, more than they ever did before. So understand that if we continue, and we must, to follow the advice of Dr. Roussin and our whole public health leadership team, mitigate our risks, follow the fundamentals. Yeah, be excited about the vaccine, but wait till it's here and beyond before we make any changes away from the defense that we've been playing. Then we're going to have more good days ahead. These are modest changes today, but they're changes that move us in the right direction, not a yo-yo. That's not what we want. We want to keep going in a positive direction. And what we don't want to do with Easter and Passover is repeat what happened at Thanksgiving. Nobody wants that. No COVID holiday. COVID doesn't take a holiday. We can't take a holiday either from protecting one another. Je tiens à rappeler aux Manitobains que nous ne voulons pas une répétition de ce qui s'est passé lors de l'action de grâce à la Pâques. Pas de vacances COVID. Remember, when you get together inside, you give COVID an opportunity to have a comeback. The level of caution needs to remain high. Stick to the fundamentals. Limit your risks by avoiding the 3 C's. Close contact settings, crowded places, and closed spaces. Wash your hands. Stay home when you or any member of your family is sick. Wear a mask. Limit your close contacts. Stay positive. Be smart. Have a heart. Stay apart. And we'll have more good news in the future. Thank you. Look forward to your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning from the Winnipeg Sun, Scott.
Hi, good morning, both of you. You say that the numbers didn't, or the survey responses didn't support dropping down from code red to code orange. That number is not included in the press release. Can you tell me what percentage of Manitobans did or didn't support that change?
Scott, I don't have that in my list. I'll run quickly through for everybody that's interested the percentage responses out of the 32,000. I don't see that in my list, but maybe we'll hit it as I go. There were 32,000 responses. 53% felt that increasing gathering limits at outdoor public spaces to 25 was an appropriate next step. 48% felt increasing gathering limits at weddings and funerals to 25 was an appropriate next step. 45% felt expanding capacity limits for retail to 50 or 500, whichever's lower, was appropriate. The top priority of the changes was increasing the gathering limits at outdoor public spaces to 25. And 39% of respondents said changes should wait until after Passover and Easter or later to prevent further spread of COVID. Those are the overview numbers I have here, Scott, but we'll get you any additional information you might like.
All right, thanks for that. What's the message then for some of these businesses? Will the GAP program be extended again, given that this is going to run into April now? What's going to help these businesses stay afloat for another month?
Well, the same things actually that have helped them throughout the entire time: innovation, entrepreneurial skill, hard work, the honest dedication of our small business people is second to none. And we've seen that as many sectors of our economy, many small businesses continue to thrive in spite of the challenges that some of these restrictions have placed on them. Our support programs have been designed to help bridge people through, sustain them so they could begin their recovery, and many companies now have done that. We've just seen the job numbers, some of the most impressive job numbers, January to February of any of the provinces in Canada came here in Manitoba. So we've seen significant growth in our employment to the point where we actually have more people working right now in Manitoba than we did before COVID. So there's no reason for doom and gloom here. We are wishing that we could have had vaccines here sooner. We all wish we didn't have the pandemic at all. But the reality is that Manitoba's small business community and their leadership have very much demonstrated their ability to rise to the challenge of COVID, and I expect that to continue. We have some other ideas that we're going to be presenting over the next few weeks in terms of some programs to assist, and I'll have more to say on that later in the week.
From CBC Radio Canada, Zoe.
Bonjour, Monsieur le Premier Ministre. Hi, Mr. Premier. Do you think it's hard for restaurants to verify if their customers are from the same household? And do you think that puts too much pressure on their shoulders?
Je pense que c'est un défi préférable les affaires fermées. It's if you have your restaurant closed, you don't have this problem. It's a good problem to have. It's a problem of reopening and gathering information on your customers to make sure they're safe and that your business is doing its part to protect the customer and to abide by the health orders is a responsible part of operating any business.
And what are you expecting from restaurants in terms of contact tracing? Was the contact tracing in restaurants efficient so far?
Yeah, as far as contact tracing, we would require restaurants to keep lists of those attending and times. And should it be required as a case is identified, then we would expect to receive that list.
From CBC Manitoba, Jill.
Hi, Dr. Roussin. Can you explain the reason for increasing funeral and wedding sizes to 25 people, but not moving the needle with respect to gatherings sizes at restaurants or other indoor settings? How is that safer?
Yeah, well, I think it's again part of the cautious moving forward with it. We've heard, especially in regards to funerals, the quite large impact on people grieving. That the very restricted numbers that we had, they were quite restricted compared to other places in the nation, but largely based on the numbers that we're seeing. So we thought that this was another way to very slowly, very cautiously reopen and get back to more things. But we can't do it all at once. And so we thought this was a prudent thing at this point. But we will, continue to watch those numbers as we move forward.
With respect to border restrictions, what was the reason behind not making any changes to the 14-day isolation requirement?
Yeah, the reason for delaying that right now, again, all of these things are always going to be on the table. We know we're not going to have that on forever, but the reason why we delayed a move on that is just the increasing variance of concern in so many other jurisdictions in Canada. We are at a race right now. We're at a race towards summer. We're at a race towards getting many Manitobans vaccinated, and we're at a race of against the third wave. And the more and more we see variants of concern in our province, the more at risk we are for that third wave before we get people vaccinated.
From the Canadian Press, Steve.
Oh, hi, Dr. Roussin. Regarding the change to drive-in event rules, it says here that the rules will be relaxed to allow people to leave their vehicles while still observing public health measures. What does that mean exactly? Because the way I picture a drive-in event is that people stay in their vehicles. If everyone can leave their vehicles, then it's no longer a drive-in event.
Right. So this is going back to some of the original wording we had for these back in previous orders, where people could step outside their car and stay in that area, but they're still distanced from everyone else. So, as you recall, we made this a much more restrictive move in when we were at a very, very critical stage in December, where we just couldn't risk really any more clusters, and so we required people to stay in their cars, windows shut. That had never been a requirement in drive-in events in the past. So we're just reverting back to the original sort of wording we had at this point.
Okay, and regarding the changes that were being contemplated, you've obviously a much more narrow reopening at this point. How long will these changes be in effect for? When's our next potential reopening phase? And are you looking for certain indicators for that next phase in terms of either vaccination rates or hospital usage?
Yeah, and so these we're going to stick with our our progress. So this is going to be in effect for 3 weeks. So April 15th is when these expire. And so the same thing, we'll be monitoring to see how we can continue our progress, that cautious reopening. And so our indicators are much the same. We're going to continue looking at case numbers. We're going to look at proportion of variance of concern. We're going to obviously keep close tabs on the strain on the healthcare system. And then now added into that is the proportion of Manitobans that receive vaccine. And so the more and more vaccine uptake that we get, the more and more likely we are going to be to loosen restrictions. So that's just an additional nice indicator that we'll be able to follow moving forward.
From CTV Winnipeg, Jeff.
Hi, Dr. Roussin. I know we're going to get asked about this from a lot of parents. Just no changes for kids wearing masks playing sports, and I guess no indoor games. Could you just maybe explain why you're moving cautiously on that? Why the masks still have to be worn playing sports?
And so in the early second wave, we saw a lot of transmission occur in these settings. And so when we moved to open this, our EPI really didn't support opening it the way we did in the fall, because we would just be back in the fall. So the real choice there was to not open it or to open it with some other measures, and those other measures were masks. And so, looking at the preliminary results of the survey, many Manitobans were also quite cautious about removing those mask requirements right now. And so we felt we would keep them in place. We want to get people back, but we still need to be cautious as we move forward. So again, something that will be on the agenda moving forward.
Okay, and my other question is, we're hearing in rural Manitoba, rural super sites rather, that people are having trouble booking for vaccine appointments, and we're hearing there's no availability in Brandon. Can you maybe address that?
I'll address it, I guess, Jeff, by saying this. Everybody is at our super sites is ready for the challenge of getting more vaccines in arms, and every site is going slower, quite a bit slower than its capabilities. So it's not an issue just for Brandon or Westman, it's an issue around the province. The super site, I was told, at Morden that we toured on Friday has a capacity to do a couple of thousand people. I think they we'll do probably a fifth of that right now, because we just don't have enough vaccines to get around. The sooner that we get the vaccines, the sooner those sites will start to be used more readily, and the sooner people will be able to get booking their appointment, and we'll all be happier for that.
From City News, Stephanie.
Hi there, Stephanie Osuk with City News. Just considering we have a couple holidays upcoming and spring break, are you worried that Manitobans might be at the point where, it's been a year of this and they're kind of sick of these measures, so they're ready to throw caution to the wind?
I think that's something that we consider at every step of this. Like we've mentioned, these orders are in place, and but we do require Manitobans to be on board. So that's why we want to have this cautious but steady reopening. And I think again we've allowed this here. Our numbers are still in the near future looking concerning. We see numbers creeping up. We see variants of concern, but despite that, we're able to continue to keep our progress moving forward on a cautious reopening. And so we need Manitobans to be on board. And again, there is a reason for optimism. The vaccines will be coming, but we just don't have enough at this point. And so let's keep looking to the future. We are going to be continuing to move forward, but right now we still have to wait on those vaccines.
Thanks. And you mentioned our numbers in the near future. What are your guys' projections looking like right now, especially when it comes to those COVID-19 variants of concern?
Yeah, and so the modeling data that we've looked at has those various scenarios depending on the type of restrictions in place and adherence to that. When we add into the mix of variants of concern, it shifts everything to the left, where for each level of restrictions, the modeling data is worse should the variant concern become the predominant circulating strain. And so we know that that's what we're at risk of right now. That's what we're seeing in other jurisdictions, and that's why we're being really cautious.
From CHVN, Taylor.
Hi, good morning. Considering we have two pivotal religious holidays coming up, how are you balancing the spiritual needs of Manitobans with their health needs?
Yeah, well, I think that the balance is a concern in all aspects of Manitobans' health, right? So we know that in other jurisdictions there are much more stringent restrictions on the ability to gather indoors at faith-based organizations. We were able to slowly increase that. We've now made some changes to drive-up services as well. We encourage people to continue to meet virtually, to reach out to friends and family. But right now, we just have to be very cautious that we don't have, increasing spread, especially over these times where people are very, apt to gather. And so it's a very challenging period of time, but we need to get through it. We can't repeat what we saw at Thanksgiving as we wait for a vaccine to come.
Throw in here as well, Taylor, and say that these are temporary measures that take into account very fully the needs of Manitobans in every respect. The consequences for folks of increased contact are greater risk of serious illness and death. And so these measures are temporary ones. The consequences of not being able to gather in a sense that many are accustomed to are temporary. And the reality is that people of faith know that there are ways to demonstrate their faith and practice their faith in a variety of ways, in addition to the normal congregate setting environment. And so we have other options. For those of us of faith would say we have other options in which to demonstrate and practice our faith, but that are less risky at this point in time. So balancing those things is a difficult thing, but it's a necessary sacrifice short term to protect the long-term best interests of ourselves and our friends and neighbors.
And we've been hearing from people that they're concerned that if cases go up around Easter, we see that third wave, that the finger is going to be essentially pointed at faith-based gatherings. How transparent is the province going to be about the presence of COVID in worship facilities around this time?
In public health, we've always stuck to reporting specifics in public exposure should there be a risk to the public, so that won't change. We've also been very clear about the impacts of stigma. No one wants this pandemic. No one wants this virus here. All Manitobans are working the best they can to try to limit the transmission. But it's just the nature of this virus that whenever we gather, prolonged, especially indoor, we're going to see transmission. So we're not here to stigmatize any groups. We're here to protect the health of Manitobans, and we're going to continue to do that as we move forward.
From the Winnipeg Free Press, Carol.
Good morning. I don't know if Dr. Roussin or the Premier can answer this, but Manitoba's job numbers, the Premier said, are impressive. Small businesses are rising to the challenge of COVID. So what would it hurt to hold off on even these modest changes for another 4 to 6 weeks? That's what some public health experts have suggested, just to allow more time for Manitobans to get vaccinated.
Yeah, well, I think these are very modest reopenings. I think there'll be a number of Manitobans that are disappointed that we're taking this cautious of an approach, and so I think that the focus mostly on these is the outdoor gatherings, which we know are safer. We know that retail settings propose much less risk because it's not prolonged contact with amongst individuals. It's less contact time between people, and so I think that these are very cautious reopenings. I think we want to keep that progress up. We want Manitobans to know that there's optimism, that we can continue moving forward. But this, I think, is a very cautious approach to that, what we proposed just recently.
And this question is for the Premier. Hydro workers have rejected the government-mandated offer from the Crown Corporation. Are you worried, Premier, about a prolonged hydro strike?
I'd like to see negotiations result in a settlement that's satisfactory to the workers and to the management. At any time, Carol, I don't think anybody likes prolonged labor disruption. I think it's important to let those negotiations take place and not have interference. As I said yesterday, I don't think it's the right thing for political people to go to the bargaining table and position themselves there. That hasn't been done in the past. It doesn't need to be done now, and I think Mr. Canoe would be wise not to do it again because he may be encouraging a prolonged situation of labor disruption if he interferes with the bargaining process. So I would say that we'd all like to see a settlement that is agreeable to both sides. The hydro management has to represent the best interests of all ratepayers. IBW has done a good job of representing its workers for a long time, and I don't think it needs Mr. Canute's help or politicians to venture in and to where they haven't been in the past. I think Gary Dewar or Ed Schreier could give Mr. Canute some advice on this, but it'd be wise for him to not involve himself in picking sides. You pick a winner, you're picking losers too. Let the negotiation proceed as it should, and hopefully we can get to a resolution as soon as possible.
From Global News, Joe.
Hi there. Good morning, Mr. Premier and Dr. Roussin. We keep hearing that more people need to be vaccinated before we get to a point where we have little restrictions. So before we get to that herd immunity stage, what percentage of the population in Manitoba should be vaccinated before you're comfortable easing those bigger restrictions?
Well, it's going to depend on the results. We're going to, even though there's vaccine, we're going to continue to follow those indicators. What we're seeing from from evidence around the world is that the vaccine is very good at reducing severe outcomes, such as hospitalization. And so as we get more and more of the at-risk Manitobans protected, we should see that start translating into less and less proportion of cases needing to go to hospital. And so those are the type of things we'll be following, and then we'll continue to be able to keep our progress of cautiously lifting restrictions.
And do you foresee us getting to a point at all where vaccinated people will be following a different set of rules?
You know, we're of course looking at that and how we can best protect Manitobans' interest with continuing our progress of reopening things. So, there'll be more to come on this. I think the message is that Manitobans who want to be done with this pandemic, want these restrictions done. The best way to do that is to get vaccinated as soon as you become eligible. So the more and more Manitobans that are vaccinated, that dramatically increases our chances of further reducing our restrictions.
There's another thing, Joe, if I could pitch in on this one. We all know that we've saved lives by bending that curve, and that's, to me, the strongest and most compelling need for us to all continue to stick to the fundamentals till we get ourselves vaccinated. But the other thing, the other group that gets forgotten in all of this too often, not by me, but by some of us, I think, is the group that is waiting for a cataract or a knee or some kind of procedure that they need to get done, and they can't do it because we're all so focused on COVID, and we have to be focused on COVID with our hospitalization demands and ICU demands taking precedence. So I remind everybody that if you have a friend or a family member, somebody you care about that's waiting, think about them and follow the health guidelines and make sure that when you can, you get yourself vaccinated. The sooner we can get enough people vaccinated, the sooner we can start, yes, reducing restrictions, but also the sooner we can get back to using our health services for the people that need them in other areas as well. There's a pandemic pileup right now, and people that are waiting know that. So think of them. And stick to the fundamentals for the next while here, for a number of weeks yet, and then we can get ourselves back to a situation where folks who are waiting for, as I said, surgeries or treatments of some kind can get back and get cared for. The sooner that happens, the better for all of us.
From the Brandon Sun, Colin.
Morning, gentlemen. Given that there's a limited supply of vaccine available right now and certain super sites are not booking any appointments, where's the province prioritizing the vaccines they do have available to go right now?
I think there's an equitable distribution strategy, but the vaccine team will be able to share the details with you. The key point to understand here is we can't let this happen again. What's happened here is we're like 50th in the world on getting vaccines to our people, and that's not good. The Prime Minister's acknowledged it on calls I've had with him. He knows it's not good, to put it mildly. And that's why we've taken the initiative here in Manitoba to line up additional domestic production, research, production, manufacturing, and then potentially distribution of vaccines going forward, because we think that that's a really important part of this. So we don't have to wait. So we don't have to have a discussion about who's getting which shortchange and who's getting more shortchanged than the other guy. That type of discussion just shows our frustration from across the province, length, breadth, east, west, north, south. We don't have enough vaccines because we didn't have a plan in place to get them here from reasonable access points within Canada. That can't happen again, and I'm pleased to see some progress being made, and you know, this is not just Manitoba. Other provinces are looking to pitch in and help make this happen. But we can't let this happen ever again. If there's another pandemic, or if we need boosters next year, and we probably will, let's be able to be sure that we're not waiting and behind 50 other countries and getting them. And we don't have to have this discussion again about who's the most shortchanged, Winnipeg, Thompson, Brandon, or Morden. That's not a healthy discussion to have. On your detail, Colin, the vaccine team will have that detail for you. We'll get it, make sure we get it over to you.
Thank you. My second question is, both Saskatchewan and Ontario are seeing increasing case numbers. How worried were you that Manitoba could join them in having a worsening situation if you had lessened restrictions in a more severe manner here?
Yeah, well, I think that's what's behind how cautious we are with this reopening here. We had many things on the table. We felt, looking at other jurisdictions, looking at the variants of concern, that it just wouldn't be prudent at this time to go with all of what we proposed. And so that's why we took this very measured response to keep us on the same trajectory. Our path is forward. Our path is continuing to loosen. But we just wanted to be, quite cautious at this point. That's why we're not changing the critical level on the pandemic response system at this point. We know we are going to be able to do that, but we just haven't at this point.
Our final reporter this morning from CJOB, Merrick.
Good afternoon, Dr. Roussin, Mr. Premier. We're just looking for some clarity on whether there's been a shift in spread in locations with, obviously, as we get more Manitobans vaccinated. Are we seeing increased or a changed pattern of spread in the workplace, restaurants, schools, or any specific location?
You know, we're not seeing necessarily any change. We know we've seen transmission occur at really, any settings where people gather indoors, and we continue to see that. So we certainly haven't seen we don't have nearly enough Manitobans vaccinated right now to see vaccines have an effect on transmission at this point. But we hope that's not far away.
And my follow-up would be, in terms of just in the workplace, what have you guys seen with just workplace spread over the last kind of year as restrictions loosen compared to some of the places with higher restrictions like restaurants and gyms?
Yeah, and so it's challenging for one, because we're talking here about mostly acquisition data, and acquisition data is difficult to come by because one is, during the height of our second wave, half of our cases are community transmission. So by definition, we don't know necessarily where people acquired this. When we do acquisition level events, we look back at where people were during their incubation period, that 2 weeks before symptom onset. And so that's a list, often long. The more restrictions you have, the list is shorter. But it's very difficult to pinpoint where someone acquired it necessarily, especially when half of your cases are community transmission.
Just to wind it up, thanks to everybody. Thanks again to Dr. Roussin. Cautious, proceeding though in the right direction. Quick enforcement update, 32 tickets issued. That's a 45% increase over the week before. Fines, 39% increase week over week. Of course, the week before last was really cold and last week was warm. I don't know, that might have an influence. Certainly our enforcement people are out there working. But I want to close with an unfortunate comment. Recently there have been incidents that have occurred where some Manitobans have been verbally and physically abusive to COVID enforcement officers. This is totally unacceptable. We all know this is not Manitoban. These are folks that are out there trying to protect you and trying to protect all of us from the effects of COVID. This past week alone, there were 3 reported incidents of verbal abuse towards inspectors who were doing their job, and there was a physical assault as well. I'll mention that there's a charge. I won't say anything about it because it's before the courts, but I'll simply say this. Remember, these folks are out there doing their best to protect you, and they don't deserve to be treated badly by you or anyone else. So if you see that happening, please stand up for these people and give them some additional protection and backup. This is not something that we find acceptable. We're not the kinds of people who do this in Manitoba, and if you see it, I'd ask you to report it and make sure that you offer your encouragement to the people that are doing this important work. This enforcement matters. It's going to be here as long as these restrictions are here and these public health orders are to be followed, and we expect everyone to do that respectfully. Thank you.